Well, hello, friends. Welcome to another episode of the Intentional Living Podcast with Emlah. I am Dr. Emlah Tubuo, your host. And today in the studio, I have with me the amazing Dr. Amanda Gilliland. Welcome to our podcast.
Hi, thanks. I'm happy to be here.
We are honored to have you. And so Dr. Amanda Gilliland is, I'm just overjoyed at this moment. She comes to us from University of Florida. She did her Doctor of Pharmacy over there. And then she decided to move to the Ohio State University, if you know what I'm talking about, where she did her residency in community pharmacy practice. I'm going to let her introduce herself. So tell us all the things about yourself.
Yeah, so you kind of nailed it. I'm originally born and raised in Daytona Beach, Florida. I then moved over to Orlando, where I got my bachelor's degree from the University of Central Florida. Go Knights. And then went to the University of Florida for pharmacy school. And then I was looking for a way to expand my pharmacy knowledge in the community setting because I love patients, I love talking to people, and I love being able to help them. And so I found my place that I wanted to be at the Ohio State University in their community-based residency practice program. So I completed my PGY1 through that program where I learned a lot about pharmacy management, pharmacy practice at an independent pharmacy, and I learned a lot about compounding pharmacy, which is one of those things that I kind of took on as one of my passions. And that's kind of what led me to you at Powell Pharmacy.
Did you see how her face just lit up when she talked about compounding? So that just, it takes it to me. I'm not going to jump the ship right now. I'm going to step back because we always want to know what intentional living means to you, my dear.
So intentional living to me, I think, is finding your passion and trying to institute that into as many areas of your life as you can. So for me, since I could speak, I always wanted to do something in healthcare. I used to say I wanted to be a baby doctor. That was the first thing I wanted to be when I grew up. And I took that passion for wanting to help others and used that through schooling, through finding a career. And I've just instituted that passion in not only my work, but also in volunteering and doing things like that, which just leads me to be really happy.
I'm happy that you're happy. And if despite the fact that you are not a baby doctor. So Amanda is not a baby doctor. She is a doctor of pharmacy.
Yes.
I'm honored to have you at Powell Pharmacy and just to have the knowledge that you have. You know, my next question, I know the answer to this question, but for our friends listening, what are you passionate about? What does intentional living mean to you what do you want to do on a daily basis that will bring a smile to your heart and to your face?
So I like helping people and I want to give them and empower patients to seek out personalized care as much as they can. And one of the best ways to do that in pharmacy is through compounding.
I know she said the word. That's what we're talking about today. Today, we're talking about compounding. So I'm going to break it down and just say, what is compounding? You know, when somebody walks up, you think, you're going to a pharmacy. I get to the healthcare provider, go to the doctor, get my prescription. I bring it to the pharmacy. I'm expecting you to, give me the prescription and tell me, take it and go home. What is compounding pharmacy? What is compounding? How is that different from regular pharmacy practice?
Yeah, so that's a great question.
Yes.
So compounding specifically, and the easiest way of understanding it is making medications that aren't regularly available. So they're not being mass produced by some type of company. And it's a way to produce medications in a way that best suit the patient. So whether that's making something into a liquid because someone can't swallow or making something in a strength that genuinely just doesn't exist out in the market yet. That's what compounding is. So it's making those medications so that way patients can take what they need and how they need it.
That is beautiful. That is one step further, the practice of pharmacy, really personalizing it. When I think of compounding, I begin to imagine the different spaces in which compounding comes in handy in pharmacy practice.
Yeah, so compounding is super helpful in a bunch of different ways. There are two main types of compounding. So you can do non-sterile compounding, which are things that you might take as a capsule or a tablet or a liquid that you just swallow, or some things that you might just put on your skin. And then there's sterile compounding. So those, a lot of people have heard about it now with sterile compounding, are things like compounded injectables. So
Like the GLP-1s and the eye drops, those ones are sterile, right?
yes, exactly. So anything that needs to be injected, like GLP-1s, or even some specialized IVs, such as people who might need those for cancer treatments or
Yes.
other IV solutions, those are done with sterile compounding.
Okay.
So there's different reasons why people might need either of those types of compounding. Like I mentioned, if you need a special compounded chemotherapy medication, you will probably get that from a special sterile compounding pharmacy.
Okay.
But then other things, so if you need a special medication for your child and it has to be a liquid, you can get those from non-sterile compounding.
Okay, perfect. All right, sterile and non-sterile compounding. So I understand that your current passion is non-sterile compounding. So let's go into it. Let's take these non-sterile compounding into the different topics. We'll start with the one that I'm most passionate about, hormone replacement therapy.
Yeah.
Tell us all the things.
Yeah, so with non-sterile compounding, like I mentioned, those are
Yes.
things that you can take by mouth or on your skin. You can also use them, such as taking them rectally or vaginally as suppositories. So with hormone replacement therapy specifically, we are supplementing women's hormones, sometimes men also, to help them get their hormone levels at the correct level so that way they can enjoy life again and they can function the way that they need to and do the things that make them happy and help with those menopausal symptoms.
I love that. She said, get the hormones to the level where I can't even say it the way you said it. That's just beautiful. So tell me some types of hormones that you compound and tell us a little bit more about the hormone replacement therapy.
Yeah, so
Different
with
formulations or the dosage forms, yeah.
With hormone replacement therapy, a lot of the times you're seeing them as either progesterone capsules. You can also get different forms of estrogen. So normally we're doing estriol or estradiol in creams, and sometimes even a testosterone cream can be really beneficial to some menopausal women.
Okay. So in order for somebody just walk into Power Pharmacy and say, hey, can I have some progesterone capsules? So that I assume that's not the case, right? Who qualifies to get hormone replacement therapy? And, what's the process? How do I go about getting some of this, getting my hormones back to where they should be so that I can function and, lead the intentional life that I want to lead?
Yeah, so one important thing to mention is that compounded medications, while we are making them, they're similar to regular medications if you do still need a prescription from a doctor.
Yes.
So step one is finding a doctor that you know and you trust and that can support you in letting them know what type of symptoms you're having. Sometimes we can treat just based on symptoms, and other times you might need some lab work done. So that can be done as either a saliva test or a blood test that genuinely tests your hormone levels. And then we customize and make the dosages the way that you need them to help get those levels to the way that you need them.
That makes sense. So exactly. So we have had Dr. Pragna Patel on the show here, and she talked a lot more. She is an OBGYN, and her specialty is perimenopause, menopause. And so she's one of the doctors I will be working with, and she's going to be at Power Pharmacy. We'll put her link in the show notes so people can connect with her, make an appointment with her, or so that way she will be able to test comprehensive hormone panel and determine. Take, for example, progesterone. So commercially, correct me if I'm wrong, progesterone comes as 100 milligram capsule and 200 milligram capsule.
Yep.
So everybody has to either take 100 milligrams or 200 milligrams. What if I need 120 milligrams?
So if, like I mentioned, if it's not something that's commercially available, then that's one of those times that you want to go to a compounding pharmacy that can make that 120 milligram capsule for you.
So that is why Power Pharmacy is a compounding pharmacy, because we want to take care of people, what exactly your body needs, because what your body needs is not going to be what my body needs. So, and that is what brings Amanda and I alive as we take care of the people that are placed around us, our patients, and sometimes these patients are ourselves, friends and family that we take care of. Let's talk about other forms of other things that we compound, not just hormone replacement therapy. Let's talk about our pets.
Yes.
Look at the way she just okay, I'm just, take it away.
So there's other people who need compounding other than just peri and menopausal women
Yes.
for hormone replacement therapy. So like you mentioned, pets.
Yes.
So
Tell us about veterinary compounding.
if we think of our lovely little fur babies at home,
Yes.
I have one, my dog Jessie.
All right, Jessie. Shout out to Jessie if you're listening, baby.
So if you think about it, there's a lot of ways, the same way that dogs and cats and other pets even shouldn't be eating human food. A lot
Yes.
of the times there's some human medications that they shouldn't be taking either. So they might need things in a significantly lower dose, especially if they're a smaller dog or cat.
Yes.
Or we can even make certain creams and lotions that you can put on the ears of your cats that can help them
Really?
with certain or with certain indications that they might need.
I'm so excited about this. So everybody gets to be taken care of in a special way, making sure that the medication goes to where we need it to go to so it can be effective.
Exactly. I think of it, it really is, we can take care of the whole family. We can make things into liquids for your babies or for your grandparents. We can make things as topicals, specialized dosages that help parents and adults just the way that they need things. So we can also make certain creams in lower dosage forms for the pets too. So it really is we can take care of you, your pets, your kids, your parents, the whole family.
You forgot to talk about my beautiful face. Dermatology compounding.
Yes. So dermatology compounding is also another big topic right now. You sometimes can hear about it in certain news articles and things like that, of getting specialized creams for your face specifically that can help kind of smooth out your skin color, help with any fine lines and wrinkles. And sometimes even dermatology offices will use specialized compounded creams in their office. So sometimes they're even seeking out compounding pharmacies to help you when you go in there personally.
I'm excited about that. I'm excited about all the opportunity that compounded pharmacy brings to open up more doors for healthcare just so that we can live better. Because again, as I say, without your health being optimal, you cannot lead an intentional life. You're going to be down, not well, or the pets is not well, your babies are not well, your friends and family are not well. We need everybody to be at optimal health in order to lead an intentional life. So I have a question for you, Amanda.
Yeah.
When you were in pharmacy school, because I remember being in pharmacy school and I was scared of compounding. When it was time for compounding lab, I was freaking out because I had to go back and, do all the calculations, do them again and do them one more time and make sure I got it right. And then when it was time to compound, I was freaking out thinking that I was going to make a mistake. So compounding never brought me the kind of joy that it brings you. I was a little stressed. So I knew that this is not what I'm going to be doing on a daily basis, 9 to 5, Monday through Friday. But the joy I see in you when you compound, did you know that you wanted to do compounding when you were in pharmacy school, when you were a doctor of pharmacy student?
Yeah, so I was really fortunate at the University of Florida College of Pharmacy that they integrated compounding throughout the curriculum. So in our lab classes, all of the lab team members at the college were really great of teaching us compounding at different levels. So we did capsules and we did suppositories and we did an introduction into sterile compounding even also. So I knew I enjoyed it from the lab class, but then in partnership with our NCPA student chapters, they always hosted compounding club, which I was a member of. And sometimes I was as simple as making candles or lip balm, but learning those kind of clinical skills.
Yes.
But then I also competed in the compounding competition, which was a team-based competition where they would just give us 3 compounds and just be like, here, go, do it. And so you'd have to figure out the right technique and the right math and learn how to do it. And I'm a really competitive person. So making it into a competition automatically made it more fun. But I loved doing it. It was so much fun. And it was a way for me to bond with some of my other classmates that enjoyed it because it's something that you don't hear a lot about in
No, you
pharmacy.
don't. Yes.
And I feel like it has such a power to help our patients, and it's such an interesting thing to be involved in. And I didn't have a pharmacy background prior to pharmacy school, so it really did start at the University of Florida.
So this is so beautiful to hear, because this brings me to intentional living as is, as we practice. We all enroll in pharmacy school. We have the same teacher. We're listening to them. And as they're teaching us different aspects of pharmacy, they light up different light bulbs in different people. In pharmacy school, you would never see me enroll in a compounding competition. But I enrolled and won counseling competitions. That was my forte. So this is, again, know what you're good at. Find the things that bring you joy in life. And what brings Amanda joy doesn't necessarily bring me joy. And what brings me joy doesn't necessarily bring her joy. So intentional living is truly finding those things that bring you life, bring you freedom. The freedom to be able to do what you want, when you want, with who you want, for as long as you want. Like, this is intentional living. This is intentional living. Finding that thing that, when I mention it, your eyes light up. I'm so happy that you found your passion, and you're living it and leading it. And you recently got engaged. I have to say that. Congratulations.
Thank you.
Mrs. How are you going to say what's going to be the new last name?
Sadeh.
Sadeh. Oh, that's easy.
Yes.
Yeah, Mrs. Sadeh. Congrats. So we're very excited about that. But the other thing that I wanted to ask you is, you are a very calm, collected, and happy person. And that's what I bring people on the podcast, people who inspire me, people who love what they do, and we can learn something from them, because I want to learn something from everybody that surrounds me. And this leads us to our intentional initiative segment. What is one intentional initiative you can share with our listeners today, Amanda?
So, an intentional initiative that I think is really important. So, as I mentioned earlier, intentional living to me is finding your passion and incorporating that into your day.
Yes.
And so, an intentional initiative that I can give the listeners is activity is really important. Being active, you're not going to be as happy if you're just laying around on the couch all day long.
Tell me
So,
about that. Yes.
finding something you're passionate about and that you love that can get you active, or even starting something active while doing something else, I think is something that I started doing that has made me, I feel better, I feel more active, I feel more energized. And sometimes that might be as simple as just, I brought my weights into our living room because I don't have very many people coming over right now.
Simplify it.
So when I'm
Yes.
sitting there watching TV, I'm like, oh, I'll go do some dumbbell curls in the middle of watching TV. And I'll do squats while watching TV. And I told my health coach that I do calf raises while brushing my teeth. And she thought it was ridiculous. But I was like, it makes my calves look better, and that makes me feel better.
That is beautiful. So it doesn't have to be the long 30 minutes of the workout. It could be just bringing the weight in the living room.
So finding those little moments that you can get more active while still doing something that you enjoy, something that is fun. You can also do a larger activity. My fiance and I met playing softball. So that's something that's really important to us. So when I moved to Columbus, I joined a softball team.
That's
So
lovely.
it can be something a little bit more adventurous than just calf raises while brushing your teeth. But
Even though that sounds amazing. I think I'm going to try that. I am going to try that. Thank you very much. It is time for Supplement School with Emlah. This is my favorite segment. And in Supplement School with Emlah, don't worry, there is no exam. There might be. But what is your favorite supplement these days?
So, especially these days, my favorite supplement right now is the Core Immune. So, with it being fall time, temperatures changing a lot, and I feel like I always get sick around this time of year
Yes.
with how much the temperatures change. It's also just flu season, COVID
Yes.
season. So, a nice way to kind of feel protected outside of just getting vaccines is the Core Immune supplement. So, I feel like it really helps keep my immune system healthy, fighting all the bad, icky things that are out there. And then also, if I ever do feel like I might get a little sick, I feel like it helps me get better faster.
That is it. That is it. And this is why, so one of the things that I do as an employer, I give the core immune supplement to all my employees at the end of August. So I just distributed, everybody gets 2 bottles, and that's going to last them 4 months. And so depending on how the season goes, and that's my gift to them, my gift of health. The reason why I choose core immune to do this is because core immune does contain vitamin C, about 600 milligrams of vitamin C. It contains vitamin D. It also contains zinc. It contains quercetin and N-acetylcysteine. So instead of, during the times when we were hit strong with COVID, people would take vitamin C, vitamin D, zinc. They take all these supplements separately. So, but why not combine them and make life simple? So 2 capsules daily with vitamin C, zinc, N-acetylcysteine. So the N-acetylcysteine, a very pivotal component of core immune. N-acetylcysteine gets converted to glutathione when it gets into the liver. And glutathione is a very strong antioxidant. Just think about it like going around mopping all those free radicals in your body and cleaning up your body. So think about it in boosting up your immune system. Also, N-acetylcysteine helps with the mucus in the body. We need some mucus in our upper and lower respiratory tract, but we don't need a lot. So thinking about N-acetylcysteine, thinking about quercetin, thinking about vitamin D, zinc, reducing viral replication. So in addition to all the things, during this fall period and the winter that we have, as Amanda mentioned, we have all these viruses and bugs, and we tend to spend a lot of time indoors. We share our germs. We share all the yucky and icky things that we don't want to share as well. So especially with people like us who work in healthcare, we're seeing all the clients and some who are not well. So we know that whatever tool you have in your tool bag to combat this, and preventive medicine as an integrative pharmacy, we advocate for people. Get your vaccines, get your flu vaccine, get your COVID vaccine, get your RSV vaccine, get your pneumonia vaccine. Walk into the pharmacy, stop by Power Pharmacy, make sure that you're asking the pharmacist, what vaccines do I qualify for, what vaccines should I get? In addition to taking my vaccines, because those are our biggest tool, we take our supplements, we take core immune, and then, and the other part that I love core immune too is because core immune is safe enough even during pregnancy. Core immune is safe enough and doesn't really have any major drug interactions with any other prescriptions. I have other people who are fond of immune essentials. And immune essentials, because it contains elderberry, astragalus, and echinacea, these are immune boosting supplements too, but they have, being herbals, they have a lot more drug interactions. Mm-hmm. So with our patients, taking prescriptions, we kind of stir them more towards core immune so that we minimize those drug interactions. So core immune, we'll put a link to purchase core immune on the show notes as well, or you could just walk into Power Pharmacy and discover all the wonderful services that we have there. Amanda, I cannot thank you enough for joining us on the episode today and sharing your intentional initiative and your passion for compounding. It shines. Even if you don't say anything, like I feel, and I'm just happy that there are people who are able to personalize medicine for us. Thank you.
Thank you. Thank you for having me on. I hope the listeners were able to learn a little bit more about what compounding pharmacy is and how it can benefit them. And I just have such a great time talking with you. I just feel like I smile a bunch afterwards.
I love it. Isn't that what life should be? So thank you for being on here. Well, listeners, thank you very much for being here with us today. Share this episode, subscribe, rate it, review this so that we get more people leading an intentional life. Be kind to your body.